Welcome back. All right, let's talk about health care. President Barack Obama talking about, of course, health care, joint session of Congress earlier this week. It included making insurance mandatory for everyone, requiring businesses to either offer health care insurance to workers or to help pay for it. The president said it is time for all Americans to have that health care.
Time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
All right, that's the president, says that his changes would cost $900 billion over the next decade, and the time for bickering is over. That was the statement made by the president, but how effective was his speech overall? Health insurance broker Craig Gussin and urologist James Knight are here, and we're going to get a couple of perspectives here this morning on this from a doctor and from the insurance industry. Both of you, good morning.
Good morning, Dan.
Doctor, I want to start with you because I don't think we hear enough from the medical profession in this particular debate. It seems to be a big political debate more than anything. And what is your take on just the overall speech from the president as he approached this?
I think the president is absolutely correct that we have very significant challenges to face in health care. And I believe both parties agree to that. It's a question of which way is the most practical way to deal with these challenges. So in terms of getting the public's attention, I think it's important that he came before the nation. In terms of which direction we go, I might have some differences.
Yeah. What are those differences?
Well, first of all, I think we have probably a $40 trillion deficit in the next 10 years. Half of that will be because of the federal entitlements for Medicare and things of that nature. I don't think this is the time to try to increase spending on additional health care benefits that we obviously can't afford as a nation. I think our #1 priority should be to find ways to reduce the cost of health care so that more people can afford coverage rather than go uninsured.
How do we deal with the indigent? When you look at the whole picture, you talk about indigent health care, billions and billions of dollars worth. So we're already paying for a lot of these folks who don't have any money anyway. Do you see that as a trade-off at all?
I think there is a trade-off. I think rather than, as we all know, about 85% of people have health coverage, and the vast majority of those people find their health coverage good to excellent. What we need to do is devise a safety net that is stable and reasonable for the indigent and the incapacitated, and reduce the amount of spending and federal spending so that we can cover those people who are the exceptions rather than the great majority of people who are generally happy with their coverage, although everybody thinks it's too expensive.
Sure, makes sense to me. Greg, from the insurance point, the industry point, how do you feel about the mandatory insurance, the taxing on insurance, the premium plans is one of the ways to pay for this? Obviously, the insurance industry is probably not real big on this.
Actually, the insurance industry has said for years, we don't have a problem going to guaranteed issue. Everybody can get coverage, but we need mandatory that everybody has skin in the game. Everybody has to sign up and get coverage. The biggest concern is how do we force people to actually buy coverage? Of the 40-some million uninsured, we can't force them to buy coverage no matter what you do. We can't force people to buy automobile insurance, and it's required by law.
Well, they're saying that they would fine a family up to $3,500 if you don't have
But you know
health
what?
insurance.
If I'm a family and I don't want to buy health insurance, $3,500 fine is $300 a month. My health insurance is going to cost more than that. There's no incentive. $1,000 a month fine would get everybody's attention.
Yeah, but it is like they are addressing it like auto insurance.
Right.
And I would say most people do have auto insurance, and those who don't really get slapped with a huge fine.
About 75 to 80% of the people have auto insurance. As Dr. Knight said, 85% of the people have health insurance. We've done it right. The cost, we need to control costs. But every country in the world, even the countries that have universal health care today, have the same issue. How are we going to control costs in the future? I think what the government should be doing is saying, okay, we're going to take all these Medicare savings that the president talked about. We're going to save money. Step up to the plate. Show us how you're going to save the money on Medicare now. And then let's talk about health care reform. We need tort reform. We need to be able that the doctor can go to work and not worry that the first $100,000 of his income goes towards his malpractice insurance.
Yeah, and of course that's what the Republican side of the aisle has been pushing for. But the Democrats don't seem to be nibbling on that at this point. It's a huge deal, and I know that doctors and insurance companies are concerned about tort reform.
Because if we brought it down to $50,000 a year, and the doctor got to keep $25,000, and the other $25,000 went to savings, I think a lot of people would be happy.
Yeah. All right. Well, we appreciate your opinions here this morning from the insurance industry and from the medical field. And obviously this debate beats on, and, you know, the folks in Congress are eventually going to work something out, we presume.
We hope.
Thank you so much.
Thank you.